Okay, Assalamualaikum. Good morning, Professor Rose. Can you hear my voice?
Yes, can.
Okay, thank you. Thank you so much for Professor Rosnah Ismail for joining our online lecture today. It is a very honor opportunity for us to because you accepted our invitation for the second time and like unlike the previous online lecture for the Undip Global Classroom, it is more like an online lecture. Not it's different with the previous lecture that is more like a seminar. But for today's session, the participant is only our students. So I hope our student can engage more and actively participated. So please, for our beloved student, ask much question and from this opportunity you can learn so many things that maybe have we haven't achieved from our daily lecture in Universitas Diponegoro. Well, maybe I'd like to introduce myself first. My name is Cita Fitria Putri. Today I will be the moderator for today's session. And the format for today's lecture, actually, Professor Rose have for about an hour or an hour, half an hour. And then it will be continued with ask and answer questions. So we have approximately 2 hours. And first, Professor Rosna will present the material and then we'll follow with the Q&A session. Okay, I think I will not talk any longer. And we already have 89 students joining the Zoom session. So I will start the lecture officially. Bismillahirrahmanirrahim. For Professor Rosna, the floor is yours.
Thank you very much to Cita Fitria Putri. Yeah, you already invited me for 2 times, but I am feel honored to receive this invitation. So student, today topic is about job stress and health model, understanding bullying phenomena among junior doctors. I chose this topic because this is something evergreen topic, evergreen phenomena. This bullying phenomena, so-called bullying phenomena, perhaps you already come across in social media. As future doctors, perhaps you feel anxiety or feel fear because this is something that you may expose in future. So it doesn't mean that it happens only in Southeast Asia, but it also happen in Western countries, in Saudi Arabia, and so on and so forth. And this bullying phenomena, it is not exclusively for healthcare workers, but also the other type of workers, including lawyer. Lawyer also having this phenomena. So this is a common, so-called common in every job title, in any type of workers workplace settings. So hopefully, whenever you listen to this lecture today, you learn something that may be beneficial to you, and perhaps you prepare mentally what is the bullying is all about, and you're able to differentiate whether this is bullying or just a simply incivility, and what kind of countermeasures that we can exert to ourselves and also to the organization. Yeah. Okay. I cannot change. Cannot change my slide. Okay, macam mana ni? Okay. So this is the content of my talk today. Okay, so first, we need to understand first what is the workplace violence, because bullying is is a subset of the workplace violence. So first of all, the workplace violence is defined as any physical assault, threatening behavior, or verbal abuse occurring in the work setting. So based on this definition, we have the workplace violence had been categorized into 4 categories. There is one, criminal intent. So criminal intent, type 1 is criminal intent, meaning the perpetrator has no legitimate relationship to our nature of businesses. So this is something like out of blue, somebody suddenly decide to rob our hospital, for example, or rob our clinic. So we didn't recognize, or we didn't have any legitimate relationship with the perpetrator, but somehow one day they decide to rob our clinic. So that is the criminal intent. So second one is client on worker. This is type 2 workplace violence, client on worker. So about this client on worker, most of the time it involves our patients, because our in healthcare settings, our client is the patient. So the client here can be the patient himself or herself, or their family members, and also visitors. Even though we know that this client may have cognitive disorders, for example, dementia or schizophrenia. So whenever it happens, still we can report it as workplace violence. That is under type 2, client on worker. And type 3 is worker on worker, meaning perhaps houseman, between houseman and houseman, or MO to houseman, or senior houseman, a few months senior to the newbies, 1 day houseman. So this is can be worker on worker. So meaning it has the same length, same similar organization level. So doctors. So it can be based on the seniority, it happen. So this is type 3 worker on worker. So bullying is under type 3, worker on worker. And last one is type 4, personal relationship violence. So this kind of violence, meaning the perpetrator has relationship with the victim, but it spill over at the workplace. It does not come under home violence, but this one under workplace violence, meaning whatever happened during their relationship, between lovers or between husband and wife, that violence spill over at workplace. It continues occur to workplace. There is personal relationship violence. So bullying at work is, as mentioned earlier, type 3 worker on worker workplace violence, and it is a process. It is a process, not a single act. So let's say if a senior scold you with harsh words, so only occur one time in 2 years, for example, whenever you undergo houseman training or doctor trainer, as doctor trainer in a training center. So it only occur once. So it is not a bullying. So because most of the time, the characteristic of the bullying is there is presence of repetitive negative behavior, unwanted, repeated, unwanted, harmful action or verbal. And it has clear intention to humiliate you, to offend you, to harm or undermine, to degrade or to hurt you purposely. They have clear intention. And most of the time, this bullying occur because of power imbalance between victim and perpetrator. So most of the time, the perpetrator will say that I do this because I am the boss. So whenever those characteristics happen, so we call it as bullying. Most of the time, bullying can cause physical and psychological damage as well as job performance. Job performance. And most of the time, the perpetrator is not many. It's only lone. It's a sort of single. Most of the time, this single individual is higher rank than the victim, than the target. Study said that 47% of them is single and higher rank than the target. And very occasionally, about 16% single individual but same rank with the victim. Okay, so remember this. Bullying is a process, not a single act. Okay, let us see to this scenario. Okay, can you read this, students? This is a screenshot from I choose this scenario because this is available in Facebook. Actually, this is a kind of story, horror story actually. But I choose this kind of scenario so that you can understand. So in this case, this MO, always target Dr. Nina and also Fatin. Nina and also Fatin. So, I baca sikit. Kami berhenti di katil 5, Puan Maria, kes diabetic foot ulcer yang dah melarat jadi sepsis. Muka dia dah mula kelabu, nafas pun dah pendek-pendek. Nina, bentangkan kes ini 30 saat mula sekarang. Nina buka file, selak-selak macam cari harta karun. This is the medical officer view. Puan Maria 65 years, Puan Maria 65 tahun, masuk sebab luka kaki, BP 90-60, nadi 110. Lagi? So MO ni tanya, lagi? Apa plan kau? Kau nampak tak pesakit ni tengah distress? BP 90-60 tu kau ingat dia tengah santai dekat tepi pantai ke? So nampak bila kita dengar tu, so we feel that very harsh word. So Nina ni adalah houseman, junior doctor. So otak dia tengah buffering. Aku menghela nafas, bersedia untuk beri arahan kecemasan bertubi-tubi. Nina, kau ni doktor ke? Kau ni pasu bunga tepi katil tu. Pesakit ni tengah septic shock. Kenapa line besar tak pasang lagi? Sebenarnya dia nak bagi arahan kan? Janganlah doktor cegat je. So dia kena pasang line. Aku nak bradula besar. 2 bradula besar. Hijau atau orange sekarang. Start fluid resuscitation, 1 liter normal saline, jalan laju. Jangan titis macam bagi minum baby. So dia jadi macam lawak lah juga tapi cara dia cakap tu in that kind of situation macam Nina dengar mungkin tak best tetapi for this MO medical officer this is common kan, to him this is so I need to instruct her so that this instruction stick to the cognitive level of the junior doctor. So dan dia arahkan Fatin pula okay, so nampak tak itulah perkataan dia kan. So nampak there is very to housemen perhaps for the first time she received this kind of instruction with that kind of intonation, so maybe something is not familiar to the junior doctor. Let's say the junior doctor brought up in a family that is her mother is soft spoken, say a very choose very words yang sopan, so dia tak ada macam ni kan. So mungkin the first time the junior doctors may feel this is the first time she ever received this kind of words, so this is not acceptable. Okay, let us see to the next scene. So this is the next scene. So what happened is that this MO give further instruction, but you can see that so there's a certain word, oksigen dah start belum? Jangan over, target 88 ke 92 saja. Ni COPD, bukan kau nak penuhkan dia dengan oksigen. Okay. So next word adalah, Fatin, kau tengah buat apa tu? Kau tengah buat pembedahan plastik ke dekat tangan pakcik ni? Kenapa lama sangat? So this is something yang perhaps the junior doctor cannot accept the instruction. So how about this scene? So this scene, after two different scene, next the third scene is this MO teach. This MO teach something. This MO teach the valuable knowledge. So tapi di soalan tanya dulu, kau dah buat Allen test ke belum? Atau kau cucuk sesuka hati macam main dad? Tu contohnya. Dan sebenarnya dia ajar, aku capai tangan pesakit tekanan ni. So dia ajar, ini asas. Dia ajar ni, dia ajar yang kat atas ni. Sorry, I point the view. Okay. So dia ajar dengan menunjuk. Dia ajar dengan menunjuk dan dia kata ini asas, pastikan colorectal circulation ada dulu sebelum buat EBG. Ini bukan cucuk kosong, cucuk kosong. So next adalah dan dibuatlah pegang tangan dia betul, jangan menggigil macam kau tengah interview dengan bakal mak mertua. Kita dengar macam nak gelak. Tapi tu dah junior doctors may not accept this kan, may not accept this. Then ni lagi yang kata tekan kuat. Dia sebenarnya dia ajar tekan kuat 5 minit. Kalau hematoma besar, nanti aku suruh kau express dari kat pakcik tu kan. Dia macam ugut actually makcik macam ugut macam ugutan. Okay. So soalan saya, ni dia nampak tak? Dia kata dia mengajar kan? Dia mengajar. Nampak ini arteri bukan vena, jadi jangan tarik macam ambil darah biasa. Biarkan tekanan arteri yang tolak masuk. So dia ajar. So dia ada benda yang dia ajar. Dia ajar yang ni juga. Okay. So seterusnya, dia cakap ni lagi, dia tegur pasal tulisan sebenarnya. Dia tegur pasal tulisan. Tetapi dia ada harsh word kat situ. Kau tulis apa ni kan? Kau tulis apa ni? Ini nota perubatan ke macam lukisan abstrak kan? Tulisan ni macam cacing kerawit tengah sawat. Tulisan ni macam cacing tengah sawat. Kalau kita orang lain, kalau kita tak kenal, bukan junior doktor, kita mungkin gelak dalam hati kan? Tetapi for the junior doktor macam, nak tegur je lah. So tak payahlah tambah ayat yang belakang tu kan? Jadi dia pun kata minta maaf. Minta maaf. Lepas tu cepat. Cepat tu bukan alasan. Dia cakap lah bukan alasan. Bukan alasan. So dia bagi ugut. Dia bagi dia macam warning lah kan. Jangan mimpi nak pergi makan tengah hari. Kau duduk sini hadap file ni sampai kenyang. So that MO bila dengar tu, dia akan jadi macam satu arahan. So in this view, kita nak perkenalkan perkataan incivility. So most of the time kalau kita tengok view tadi tu, nak panggil dia incivility ke bully kan? Kalaulah senario tadi tu berulang-ulang kali, setiap hari, setiap masa, sepanjang 8 jam ataupun 16 kerja ataupun 24 jam tu kerja, so that MO doing similar thing repetitively, dan dia niat dia adalah untuk undermine ataupun to hurt the junior doctor, and plus dia adalah dia power imbalance sebab dia MO MO dengan houseman kan, MO dengan junior doctor. So dia ada power imbalance di situ. Dan in Malaysia we have this kind of MO can evaluate this HO performance, this junior doctor's performance. So this evaluation may affect the career for the junior doctors, where they able to be assigned appointed as contract workers or permanent workers in future. So this kind of evaluation may have a kind of merit or may have kind of weightage for the performance. So perhaps the junior doctor may feel burdened whenever they exposed to this kind of MO. You need consider this one, incivility. Incivility, so we can see that from the previous scenario, so the MO, the medical officer, yes, of course they're being rude and discourteous actions because of the comments, because of certain comments, name calling, padahal that Fatin tu, it is not Fatin actually, nama dia Farah, but during that scenario, he always call Fatin because there's a history for the medical officer because his fiancé died. Serupa macam Farah ni, there's a resemblance between Fatin and Farah that makes Dr. Farah tu, that he always call Fatin, become a victim because he's not able to move on from the previous episode because his fiancé died due to vehicle accident. So name calling, expressing public criticism, refusing to assist co-worker, but in that scenario, dia tunjuk cara. So he teach in certain ways on how to do things correctly, to do procedures correctly, show a lack of respect. I don't know, if I leave it to you whether that medical officer show some disrespect to the junior doctors. And sometimes certain workplaces may have this spreading rumors or gossips. Okay. But bear in mind, incivility can lead to bullying. So that's the problem. So if occur one time, so we can understand that yes, we need help. and perhaps that person so angry to us. That's why he has he adopts such behavior. But whenever it is repeatedly occur, so this instability can lead to bullying. Okay. Phenomena of bullying in developed countries. This is based on US study in year 2021. In year 2021. So workplace bullying surveys, it mentioned that 79.3 million US workers affected by workplace bullying. I mentioned earlier, so this bullying phenomena does not exclusively in Southeast Asia, it's occur also somewhere in this world. And this is about the who is become most of the time the victim does not aware that the bullying is already occurred. So you can see that 34% of them does not aware, and 19% of them witness, being a witness. Okay, so co-workers, between co-workers to co-workers, it's less, but bosses to the co-workers, it is very common, but rarely workers to the top to the senior or to the supervisor. Okay, that is in US. How about this in South Australia? So this among junior doctors in South Australia, so 22% of them reported bullying. And 70% of this experienced bullying does not report it. In Malaysia, we have similar. So, but it's less compared to the South Australia. So 13.3%. But the perpetrators is like this one. So most of the time, the medical officer compared to the specialist. Houseman and houseman is differs lah, smaller. Okay. The issue is, why junior doctors vulnerable? That is because junior doctors is always perceived as the lowest form of life in hospital setting. So these kind of terms, the lowest form of life, I think that is still relevant till now. So I firstly, when I first heard this kind of statement, you are the lowest form of life, so bear with it. So this is my professors during year 1990s. So now is 2020 something. So during my years, my dinosaur time, so my professor say like this: whenever you come to a hospital, you work as junior doctors, you are the lowest form of life in that hospital. So initially, I cannot register this kind of term. What happened? The lowest form of life, what do you mean? Sampainya hati You said to the junior doctors, you are the lowest form of life. So, but this is something that we need to accept in medical world, not to say to accept lah. This is something that you need to embrace, and to think about it, because you are the most vulnerable person. You are the newbies in healthcare settings. So most of the time, as newbies, you prone to make mistakes because we are still learning, kan? And this is a kind of learning curve in your life. Being a medical student is another story. Being a junior doctor, another story. So sometimes, being a medical student, it does not click with the being junior doctor, because real life, it does not in study world does not reflect the real life. So whenever you enter the working environment, the working world, so as junior doctors may experience the reality shock, because during medical students, you have exposure very little compared to whenever you work as trainee doctor or junior doctor in that hospital. It's very different, because as a medical student, you can come and go to the ward and you learn from the patients, and you perceive the patient as your textbooks, and you learn so much from the patient, but you really focusing on the protocol or procedure in the ward, how the staff nurse and patient relationship, how the feelings whenever there is a grand walk around. Perhaps some students may experience as such whenever they can join grand walk around with specialists. But during that situation, it's different because the specialist or the medical officer treat you well because you are the medical students. So being medical student, this is that kind of responsibility. Being junior doctor, there's a larger amount of responsibility. And this kind of work environment in hospital setting, most of the time it is emotionally triggered working environment, emotionally triggered, because we sometimes as newbies, you have more emotions and you feel more sympathy to the patients. But compared to senior doctor, perhaps their emotion become less because they understand the patient's condition and they know how to think objectively compared to newbies. So being newbies, you think differently from the senior because you are the fresh graduate who experience the reality of the world. Okay, so you are perhaps the stress reliever punching bag. Most of the time, whenever a senior doctor may experience stress, so you are the best person as the stress reliever punching bag. Whenever they do grand walk around. So whenever you make a single mistake, even single mistake that does not desire to be scolded, so perhaps you being scolded for that kind of mistake because you are the punching bag. And perhaps the presence of as junior doctors, you have these overloaded emotions and you feel, oh dear, as doctors, so this work no longer sexy, even though I can put my stethoscope around my neck, but actually I have this legal and ethical responsibility for patient. And meaning sometimes we have this kind of feeling whether we are competent enough to touch the patient's hand to do procedures. So that is something that you need to embrace as early as you can. You need to adopt that, yes, during this time also, yes, you need to learn that whenever you are a doctor, whenever you call a doctor, so you have this legal and ethical responsible for the patient. So just imagine, as newbies, you have these emotions, chaos in your mind, and you exposed to chaotic environment created by the patient and by the specialist and by the nurses. At the same time, there is interaction, human and human interaction. Even the slightest harsh words, it can lead to a hard feeling. Okay. And some junior doctor may have this lack of practical skills, such as venipuncture, inserting IV lines, or performing correct CPR. So this is a must skill that you need so that you can perform better. So it does not you does not become a targeted victim. There's no proper orientation. So meaning sometime whenever you transfer from what orthopedic, for example, as junior doctor, from what orthopedic to surgical, so there is a different arrangement, there is a different hospital logistic or different setting for the material or equipment. So there's no proper orientation by nurses ward or by specialists to make sure that you know where to find what, or you don't know how to follow certain protocols. For example, in orthopedic ward, different compared to the surgical ward or in operation theatre. So there's a different culture there. So you need to understand this. Whenever right now you are the medical student, you need to aware this kind of factors that makes you vulnerable. And this is the first time perhaps you such a long working hours, hectic hours, and also frequent on-call duties that may exhaust your emotions, that makes you vulnerable. And perhaps you have experience, you will have this experience panic when facing critical clinical decision while waiting the medical officer comes to help you. So you are the one, the first hand to handle the care of the patient in your wards, for example. So sometimes you need to make certain decision, certain even simple decision that make the patients survive. For example, order like order blood glucose reading, for example. So whenever the medical officer comes, you already have the results, because that is something that you can decide during junior doctors training. And perhaps whenever you already feel vulnerable, emotionally, cognitively, and physically exhausted, and you have no support system. You have no support system, and everybody says to you like this, biasalah, this is experience. You are the junior doctor, kan? You need to face this. You don't have this kind of space to ventilate your feeling. You don't have this space to membawang to each other, to the other housemen, because you feel afraid that this whatever you say, it is not safe for you. Perhaps this whatever you say to the other person, it may bounce back to you most of the time. So at the end of the day, you suppress this emotion, you suppress whatever unsatisfaction, you suppress whatever unwanted feelings. You cannot ventilate it to the other person, or you don't have time to ventilate. You don't have time to have this me time, for example. So that's why it makes you more vulnerable. And only family member know your suffering most of the time. So I can see that the previous one is our Ministry of Health in Malaysia. So whenever her daughter joined in as junior doctor, now he become understand why junior doctor so fatigued and but having less salary. So because of that understanding, so we have a better salary compared to year 1990s or early 2000. So this is the 2022. So this is another politician saying that um, saying that uh, inilah dia kata waktu pekerjaan yang tidak berperi kemanusiaan. Waktu pekerjaan yang tidak memberi kemanusiaan. So only family member knows this problem. But as essential services in healthcare is essential services. We don't have much leisure to demand a lot of things, including office hours or working 45 hours in a week. So we don't have such luxury. So this is something that you need to understand. Okay. So some say, whatever you experience, we call it as tough training. Tough training. But we need to consider tough training, is it equivalent to bullying? Or you perceive it wrong, you said that tough training is bullying. So the criteria, the tough training is that the service first model. Whatever you have, even though you have family issues, even though you have your own issues, so you need to come to the hospital and give a service first. That is the criteria of tough training. This is relevant to the healthcare workers. So the junior doctor will be the healthcare workers. Service first, whatever happen, even tsunami, even any emergency flood. So whenever you need to come to the hospital, you need to come. So you cannot say that, okay, I have flood at my home, so I cannot come to the hospital to serve for the community in carrying them for their health. Cannot. So most of the time that one. In certain university, this understanding service first model is very important, and this is one of the psychometric measurement. Whenever they measure the student psychometric, the future student, medical student psychometric, so this is the element that they're looking for. So you need to understand that even your sister's going to marry, so your hospital work is the most priority one. Hidup dan matiku adalah untuk patientku. So this is the psychometric the trait that we need, the trait that we need from the medical student, that because this kind of medical student going to be the future junior doctor. So you cannot say like this, okay, I need family life balance, and there's no such thing family life balance in medical care. You can have, but later whenever you become another, you choose another specialty, so perhaps you can consider that, or you choose in private sector compared to government sector, because government sector there's a lot of burden compared to private. So in private perhaps you can choose such words and lifestyle, work and life balance. So another thing, the tough training criteria is high demand clinical workloads. High demand clinical workloads, for example, in government setting, patient intensive daily tasks limit the opportunity for teaching and learning. So because of many patients that we need to take care of, so we don't have that time. This is different compared to medical student teaching and learning session. This is different. During your junior doctor's training, this is another story. So perhaps you have the tough trainings. Another one is there's a features of undersupervised decision making. So as junior doctor, you need to know what to do in a very short period of time. You need to do some decision in handling life-threatening, as simple as hypoglycemia situation in patient with diabetic patient. And this is another factor, criteria, tough training, complex, unpredictable patients, and also varying demands, but make consistent and such learning difficult. Another criteria of tough training is high stakes and emotional pressure. For example, in our setting, so we always have these kind of issues and dealing with patients dying or suffering, dealing with uncooperative or distressed patient, working in specialties where small errors can have devastating consequences due to judgment errors and personal accountability. So this is the criteria of tough training. And one more is the professional and hierarchical pressure. As I mentioned earlier, so the lowest form of life, everybody will look into at you and scrutinize what your job, whether it's correct or not. Even nurses, even medical assistant, because you can have certain skill, you can learn a good skill from nurses, for example, as simple as giving intramuscular medication. So being a teacher, let's say the nurses become a teacher for you in one day, so you can learn certain skill from them. Then you need to consider yourself, yeah, even though I am a doctor, but she is my teacher, even though the nurses is the between doctor and nurses. So doctors is higher, right? But even though you need to learn that skill from nurses, but it does not undermine your status. So of course, to some people, to some junior doctors, this is a kind of pressure. How come I am the doctor, so need to learn this skill from the nurses? So don't be like that. So always make yourself humble, and you can learn anything from every person in the room, as long as you are ready. As long as you are ready, a student. So everything surrounding you is a teacher. Is a teacher. And perhaps you have this difficult relationship with senior staff and feeling underappreciated. So in this medical world, there is no such, okay, good job. Every time you do a good job. So whenever you receive a praise, make sure you ready to receive criticism also. Junior doctors, most of the time, junior doctors, perhaps during on-call time, left to handle cases beyond their experience level. Sometimes it happens while waiting specialist or medical officer on site. So you need to handle, You need to handle, because everybody looks at you. You are the doctor. Please decide. Even nurses, senior nurses may test you to say that, okay, in this kind of situation, doctor, what do you want to do? For example, so you have this kind of pressure. How do I know? This is the first case I ever handled in my life. So if you have this very good relationship with the other professional, for example, nurses, so you can, okay, based on your experience, sister or staff nurse, what should I do? So always be humble. So it's okay if you can do like that. And sometimes during tough training, so there is presence of ineffective feedback mechanism, like we already observed in earlier scenarios. So there is a feedback, but it is not effective enough, because it makes the content of the instruction or the content of the feedback is unacceptable. And tough training need this kind of resilience, personal resilience and physical endurance. Physical, although as a healthcare providers, as junior doctors, physical does not a big chunk for the job demand. However, you need this physical endurance to ensure that you can run while emergency or pushing a patient trolley. You need to standing, walking, so you don't have luxury time to sit on the chair. You need to always on the foot to make sure that you can everly ready to attend your patient's care, to attend the patient's need. So this is something that in tough trainings, physical endurance plus personal resilience. And resilience is very important. It does not only mental resilience, but also cognitive resilience, and it requires as a whole to ensure that you are resilient enough to face this kind of challenge during your junior years. So this is something that I already mentioned earlier, sink or swim culture. So you need to know something. So ability to learn quickly, know unknowns versus unknown. This is very dangerous. So you need to know what is unknowns to you. Always can say that, yeah, I don't know. No, please teach me. Please help me. Please teach me on how to do. But you need to have this kind of trait, quick adaptability to a chaotic work environment. Okay, this is example of bullying. So I already teach you about what is incivility, what is bullying, and this is the example of bullying. So this is the example of bullying. Offensive joke also bullying. Okay. Some people say like this. I do this because I am motivated by a desire to improve the junior doctor's performance. So some perpetrators justify their action by saying this. For example, like the previous scenario. So the doctor, even though he said like this or his reaction like those, so at the end of the session, he teach something, valuable skill to the junior doctors. So most of the time they will say like this, I put this kind of word so that whatever I teach you now, it stick in your mind. It stick in your mind and you become a better doctor. So this is another so-called justification for the perpetrators to continue to do whatever they do lah. For example, like this one. This is the scenario. So pukul 5 petang, semua houseman nampak macam mayat hidup. Fatin mata sembab. Ni Fatin ni tadi sebenarnya serupa dengan Farah. Farah tu nama sebenarnya, tapi dia panggil Fatin. Fatin sebab rupa dia serupa dengan fiancé dia. Nina pula muka dah tak ada warna, aku masih segar, rambut aku masih kemas, baju aku tak ada kedut. So dengar sini korang berdua, aku panggil. Korang benci aku kan? Korang rasa aku ni kejam, mulut puaka, tak ada hati perut, betul? Tapi mata dia orang bercakap, ya, mulut tak cakap lah kan. So bagus. Aku memang nak korang benci aku. Sebab bila korang benci aku, korang akan buat kerja lebih teliti sebab korang takut kena maki. Kat hospital ni, ketelitian kau menyelamatkan nyawa. So dia justify his action. Aku tak perlukan kawan dekat sini. Aku perlukan doktor yang efisien. Kalau korang nak jadi lembab, pergi kerja kat jabatan lain. Selagi korang bawa aku, korang kena tajam macam pisau bedah. So inilah dia niat dia sebenarnya. Dia tak adalah kata nak ni, tapi niat dia untuk menyebabkan these doctors, junior doctors ni tak suka kena marah. Dia tak suka kena marah, so mereka lebih teliti dan akan buat kerja lebih bagus. I do not know whether this is correct or not. So, but it is a cyclical in nature. So most of the time as junior doctors, we may take any experience as half full cup or half full glass or half empty glass. So most of the time in any experience, we can take what kind of the lesson learned. What is the lesson learned that what action that I need to do so that this experience, I may not experience this experience later, this scenario later. Okay, so this is the word. Okay. So most of the time people will ask, is open expression of anger considered bullying? Yes, so there is a characteristic, and whenever it feels certain characteristic of bullying characteristic, for example, intention. Intention is to humiliate or degrade or hurt a person. So that is bullying. And it present repetitively. Repetitively, whenever he saw, the perpetrator saw the person, so he always like that. Even though the person just standing there without doing nothing pun, mungkin kena marah lah contohnya. And that perpetrator show the power imbalance. Sebab dia ada boleh use power to intimidate or vulnerable person. Tapi dalam case scenario tadi dia tak guna gitu. Cuma dia kata bagi takut kat dia supaya the doctor become efficient doctor. Okay, berbalik kepada cerita tadi, tough training, bullying ataupun tak. So I leave to you guys to digest this kind and you decide. My task today does not to say which is correct or which is wrong, because different culture may have different ways on how to understand things. So I leave it to you guys to understand first. But in my opinion, this is something that we cannot consider as bullying. Expressing differences of opinion. Even though sometimes they express differences in high tone, high intonation, or macam nak gaduh kan, cara cakap tu bukan lembut kan, sebab it depends on whoever deliver the message. So sometimes they want to express their differences, but whenever they express differences, dia punya intonation mungkin jadi kuat ataupun jadi macam marah, but sometimes that is the nature of the person kan. So please consider those things, whether that is the person's nature, or perhaps this purposely done to show that you need to take my opinion. No, you need to consider those. In Malaysia, for example, in Malaysia we have this kind of differences. Those yang from Malacca state compared to those come from Perlis state. So Malacca state, they have this kind of very energetic voice. And for like me lah, I am Malacca state, born from Malacca, so I'm Malacca state. So most of the time Malacca state like me, so they have this kind of very energetic voice. Some people perceive that energetic voice as angry voice. So there is another element that you need to consider. Compared to Perlis state people, so they are most of the time they talk with softer voice. They talk with good choice of statements. So they have a different in term of words and also the intonation. So that makes the difference between Malacca people and also Perlis people. Or perhaps this is not considered as bullying, offering constructive feedback or guidance or work, guidance or advice about work, or reasonable action taken with good reason, changing work assignments, scheduling and workload, delivering work instructions. For example, like previous scenarios, delivering work instruction but with using in extra words lah, assessing and evaluating work performance, disciplinary action, and other reasonable and lawful exercise. So most of the time you need to consider whenever you experience whether this is bullying or incivility, you need to look at whether is there any law define such event. So is there any terms that is by literature saying that this is acceptable terms, but it depends still influenced by your culture of living and nature of your life from child to the adults. It depends on nature or nurture. Nature or nurture. So you grow with that or you born with that. So it depends. Okay. So to understand those, we need to understand this job stress and health model. Job stress and health model. So this one introduced actually the preliminary work by NIOSH, US NIOSH 1999. Whenever you type stress at work model, so most of the time the literature will illustrate the NIOSH 1999. However, Hurrell and Calloway extend those framework and it called as job stress and health model. So whenever you expose to at work that affects your that affect your physiological changes, we call it a psychosocial hazard at work. So whenever you expose at work due to the interaction between the human and work environment, the interaction between it, and it change your physiological parameters, your BP very high, from calm to become angry. So we label it a psychosocial hazard at work, and it creates flight or fight responses. You want to fight or flight responses. And this lead to acute stress reactions. So we are the one who decide we want to fight or flight. So this is something happen whenever your system exposed to that hazards. So it will show this kind of reaction. And at the end of the day, if does not continuous, if this acute stress reaction continuously occur, so it will lead to health effects. So this is something that you need to consider to understand why certain people who experience this stress or distress at work may have this kind of health effects. This kind of model, it is not straightforward. So most of the time, there is a moderator for this reaction, whether flight or fight response. So it depends on the individual personality traits. It depends on the individual factor, for example, as simple as personality trait. Who are you? Whether you get anger easily, or perhaps you are very perfectionist, or perhaps you cannot, certain people cannot accept being scolded like that, or perhaps you have low self-esteem. So this is something about trait. And it also influenced by the career stage as junior doctor, of course. So this is the career stage whereby you have very minimal experience in taking care of the patient, and also based on your perceptions. Whether you perceive whatever you experience as a hazard or not, whether you perceive it, this is bullying or incivility. So the perception also act as a moderator for this response. So this moderator is the third variable that may change the cause of reactions. So whether it heighten the stress reaction or it perhaps it dampening the stress reaction. So that is the moderator. So whenever you have this kind of variable, you yourself that determine whether the stress reaction can be exaggerated or it can be lessened. Okay, next. So this psychosocial hazard at work also, it has interrelationship between this. So whenever you expose this, so you have this interrelationship. And another third variable is non-work factors. For example, financial. For example, family situation. So let's say mom, it is not that well. Your family have certain issues. You lost certain valuables in your life. So this is non-work factors also act as a moderator. And also buffer factor. This is the third factors as like act moderator. There is buffering factors. That is social support. Social support and coping mechanism, how you cope. So and these two factors also interrelated to each other. And bear in mind, these variables interrelated to each other. And whenever you experience ill health effects, so at the end of the day, it also influences this kind of relationship. It influences the non-work factors also. And these factors also can influence this kind of element in this model. Okay. Let's say we use the bullying phenomena. So the bullying phenomena, so this is the thing. The psychosocial hazard, I replace it with tough training, bullying or incivility, feedback mechanism fails, and this create this kind of responses, and this lead to this one. And being individual, you have a certain personality trait, of course, vulnerable newbies, and whether it depends on your nurturing or nurturing background that may influence your resilience level, some either high or low resilient level, and also shape your perceptions towards a certain scenario, towards an experience, towards an event. Okay. Okay, I hope you understand. Okay. So these factors influencing the impact of stress, as I mentioned earlier, it depends on the meaning of the stressor, meaning of the experience that the junior doctor may face, personality type, number of stressors. So number of stressors is very important. Magnitude of stressors, and also the level of an individual, whether you are mature enough or not mature, ability of social support, and also the environment. And I can also explain this is to understand further the job stress and health model. So we need to understand first why this person factors, the individual factors, act as a moderator. So as I mentioned earlier, whenever a person exposed to an experience, at work, daily experience, work life experience, so whenever they experience unpleasant event, for example, like the previous scenario, so the person, it depends on the person to decide whether this is challenge or threat. Whether this is challenge or threat, whether this is benign or irrelevant. If it is benign or irrelevant, it's very easy. So most of the time, that person can ignore that event. So it can ignore. But if it perceived as challenge, so most of the time you will think about what kind of resources internally and also externally, so that we can cope with those challenge. So that we can cope those challenge. So that you start decide individually without you aware. Physiologically, actually, you in at individual level, you start choosing. You start choose what is the best approach to face the event, for example. So most of the time you have these psychological responses. So how to face this, how to cope. Perhaps you need to consider, okay, so his word does not mean anything to me. So whatever his word comes from the enter to my right ear and also left to my right ear. Oh, something like that lah. Or perhaps it's alter the behavioral responses. So some junior doctor may adopt certain things like, okay, I feel stressed today because of work, I need to eat cake. I will eat fried chicken, for example, or I need to drink soda. Or some people may choose certain substances to calm their nerve. Sometimes. And this lead to all those sort of biological responses. So whenever you treat the challenge or benign or relevant, so most of the time the outcome is healthy outcome, compared to if the person experience the event and it she or he perceive as threat, so that there will no longer good coping behavior. So those responses will be magnified. Depends on your based on your thinking process, and it paralyze all those system. And this system doesn't work with the coping and so on and so forth. It is not there. It's not there. So what happened is that so the person may suffers as the consequences of the event. In our life, so there's a theory stating like you need some amount of stress. You need to have some doses of stress so that you will perform better. So this is already proved by this Yerkes-Dodson law 1908, stating like this one. imagine if you have no stressor that may flicker your heart or flicker your mind to do better. So you may feel complacent. You may feel okay. I think my skill is enough. Okay, I can settle down right now. So you don't have to have more skill or more knowledge in future. So you guys got some law stating like this. So we need some amount of arousal, some amount of stressor, so that you have performance. But the problem is okay, sorry. You mentioned that some amount of moderate around, so between low and high, this is moderate amount of arousal. So it can you can achieve the peak performance like this one. So this one optimal arousal with the optimal performance. If too little of arousal, if too much arousal, so you will have anxiety or impact performance. Whenever you give good arousal, so the attention and interest will increase. So this is Yerkes-Dodson law state years ago. To some people, this optimal arousal is we talk about limitation. Because if the person experience more stress, so the trend become downward. So to me, this is a kind of what is your threshold limit? What is your limitation? What is your threshold limit? Cognitively, perhaps difference with the emotion, and also physiological. It depends on each individual. All right. I show you that theory based on my study. This one is, but I didn't get that kind of curve because this is linear. This is a linear relationship. The curve, the previous curve, it is a curvilinear. This one, a curvilinear relationship between arousal and performance. So my case, so this one is linear. And in my study, it shows that those people with high anger and low forgiveness are vulnerable profile. So whenever they exposed to high emotional demand, so they maintain status quo, so it does not affect very much. This one is resistant profile. Even though they show high emotional demand, I think something wrong here. Let me think first. Yeah. So this resistant profile, even though the person experienced high emotional demand, the psychological job stress, it is not that the amount of the point that increase on the job stress does not increase very much compared to this profile, high anger and high forgiveness rate. So this one, whenever they experience low emotional demand and high emotional demand, so the changes is much more than around 2 units. This one around 1 unit. Okay. And okay. Hypothetical scenario. This hypothetical scenario. So I get that kind of a curvilinear relationship between job stress and uncontrolled eating. Let's say a person who have high stress job. So those person with high anger trait may adopt uncontrolled eating behavior more compared to the low anger trait. Let's say this hypothetical scenario, uncontrolled eating behavior, we change with this depression. So of course, this one hypothetically, I does not do study yet. But this is something that we need to consider to understand how this personality trait become a moderator. So this graph shows that moderator analysis, it shows curvilinear relationship between job stress and uncontrolled eating, but hypothetically, I change the uncontrolled eating behavior to the depression. So those person with high anger trait may have higher depression compared to the low anger trait person. Okay. So let's say, this is from my study. So we know that, so those person with high anger, high uncontrolled eating is the highest risk of having probability of cardiovascular risk more than 10%. What if hypothetical scenario, Like this one. Like this one, meaning high anger, high depression may lead to the suicidal action more than 10%. So this is something that to show you individual is very important to ensure that it heighten or it lessen, dampening the effect of either the reaction or the action, reaction or the action. So this one adalah action. So this is the hypothetical can happen. Okay. Hypothetical scenario can happen. So statistics show like that. Okay. So first, then we need to understand the psychological mechanism of bullying. Why did someone start bullying? So perhaps the perpetrator having this unrealistic self-image. So meaning, seeing oneself as high performing, meaning dia lah yang paling bagus, rather than domineering. Or the person have high self-esteem, so lead to perfectionism, arrogance, and narcissism. So he or he cannot accept the imperfectionism. Or perhaps that is the behavior that they adopt to maintain I am the most powerful person, to demonstrate to the other people in that room, I am the most powerful, and my decision can influence your life career, for example. Or perhaps that person, that perpetrator, feel protected. And whatever he or she do, there's no consequences. There's no legal consequences. So for those people, most of the time, they have this kind of link with minister, or his or parents have link with the minister, or rich people, or they have link with pengarah hospital, with hospital director. So they feel protected. They are shielded from the any legal implication. So that's why they start bullying. Or perhaps they have this kind of habit, transfer their stress to the others. Or perhaps their system, their physiological system, having this aggression-related hormone, for example, very high testosterone and low cortisol because of not enough sleeping. So high testosterone, low cortisol, so it associated with the reactive aggression. And perhaps the person experience serotonin deficiency or vasopressin or high adrenaline that can cause impulsivity, impulsive nature, or violent behavior. Or perhaps the person itself, the perpetrator, having this kind of mental illness, for example, like the story in Facebook story. So actually, he has challenges. He himself have own challenges mentally. So that's why he transfer those, he reflects, whatever he do, he reflects actually his own condition. Or perhaps the perpetrator have this personal issue, childhood bullying, death, or loved one. Or perhaps this person have lack of resources, does not enough help, or heavy workload. Okay, this one does not relevant. Actually, this is to simplify whatever I have said earlier. So what is the outcome? What is the outcome? What is the outcome of this is the individual can be mental health, anxiety, stress, and depression. So as junior doctors, it may impair your cognitive. Actually, you can perform, but you cannot perform just because of that perpetrator exists, or just because of that perpetrator happen to be supervise your job. So you feel you can perform in usual environment, but because of that person presence, you cannot perform. Sometimes like that. And perhaps lead to reduced coordination and not able to make sound clinical decision. And to some people, it depends on the nurturing background, nurturing family background. So they always perceive that as criticism, but it is destructive in nature. So they never able to think about, he teach me to be better. Sometimes that kind of words does not click to their mind. So most of the time, whatever they say, even we say in a very good words also. So most of the time, whoever receive it, in soft manner, he criticized me destructively. Or perhaps some perceive as sarcastic comments, or humiliate in front of others and causing loss of confidence. And perhaps some people may have this post-traumatic syndrome disorder, PTSD. Ada juga kan. Okay. Some people may use some medication to reduce their palpitation, to reduce, to feel that they feel brave. As simple as perhaps use propranolol so that they not feel palpitation whenever they have these kind of challenges during junior doctor or whenever they want to present case, so they want to feel that calmness. So some doctors use medication, propranolol, surprisingly, and they hook this kind of medication whenever, even specialists, so they use this kind of medication because they want to be perfectionist. So palpitation may cause them to perform lesser from what they expect lah, right? So use of substances, and some people use sleeping pills so that they don't have this nightmare following the incident previously that they face. Some people may have unhealthy relationships. And the final one, suicidal ideation or action. Suicidal ideation or action, this is happen in US, in developed countries. In year 2021, 3 doctors just died, and they died within 8 months to each other. Same hospital, same department. So you can Google this kind of story. So there is a blog for them. So I choose, I use here, I illustrate here using Pamela Weibel blog. So it mentioned about these doctors from the same department, from the same hospital, having suicide and also accidental drowning within 8 months. 3 of them died. Okay. This is this is the data, supporting data among US medical residents, stating that suicide is higher. Suicide is higher in for the data 2015-2021 compared to 2014. So it higher, 6.7 compared to 5.44. And in Malaysia, we have similar. So Dr. Platih terjatuh, falling from the apartment. Falling from the department. This is a news report, but we suspect that perhaps there is so-called bullying phenomena in the hospital. And also recently, very recent, this is happened in bulan Ramadan. This is Muslim female junior doctors. Dijumpai mati di bilik air asrama hospital dan tergantung menggunakan kain selendang. So to that extent, so now this case is actively investigated to see is there any psychosocial hazard at work exists. And this is the organizational outcomes. So yes, we accept that bullying of junior doctors is a patient safety issue actually, because junior doctors have more close relationship with the patient because they are the one who is the main player in the ward, and they are the one who handle the patient more than specialists. I mean the contact hours. The contact hours of these junior doctors and patient in the ward is more compared to specialists. That specialists come to see the patient during ward round, during grand round, or during procedures, especially operation, for example. But these junior doctors know all insight about the patient, including who is relative come to visit to the patient, which son or daughter that visit the patient today, which or a son or daughter that they already tell the complication of this patient. So the junior doctors is the one. So whenever these junior doctors jeopardize, so it is become a patient safety issues. So whenever this junior doctor experience the fear-based work environment, so they won't able to speak up about the safety, or may not but they may not ask for help, or they may not ask for opinion. For example, am I doing correctly? Am I doing this procedure correctly? Can you supervise me to do this procedure, for example, or can you comment constructively to ensure that to ensure that so these poking needles will enter successfully. It does not require 2 or 3 times, for example. Or this junior doctor, bullying of junior doctor is a patient safety issues because hostile specialists or MOs causing the junior doctors cannot feel safe. Cannot feel safe. So at the end of the day, they don't know how to manage the patient care. And constant criticism cause skill erosions. So they don't want to learn anymore, or perhaps they're doing it wrongly, and serious errors cause skill erosion and serious error. So it can be medication error or mistakes during procedure in care, surgical care or patient care, leading to patient death. Or perhaps absenteeism and low morale. So whenever they experience being bullied, so they transfer to the patient also. So they bully the patient. So that perhaps they won't come to the hospital regularly. Absenteeism, so whenever the main player is not in the house, so the quality of care may drop, for example. And it also causes systemic cause, whereby this victim, junior doctor, become a victim of bully. So they don't want to further their housemanship, or they don't want to finish, they don't want to complete their training. Because most of the time in Malaysia, we don't have this luxury to transfer the houseman from one hospital to another hospital during their course, let's say 1 year or 2 years. So they don't have this luxury to transfer. So they need to face the reality for solid 2 years. So whenever they feel like that, so they don't want to let's say, they don't want to see that surgeon anymore. I don't want to see that specialist anymore. I feel so hate that I think if I stay here, it is not good for mental health. I don't want to be a doctor anymore. I want to go away. I don't want to be a doctor anymore. So this is a cause because meaning we fail you're excellent in academic, but you cannot perform. You cannot be the doctor as we expect lah, because you drop in the middle of the just the beginning of the journey. And silent skill. So we already mentioned earlier. So there's a case, real case happened. So whenever this junior doctor keeps silent and they don't want to share their feelings because there is no space for them to do it. Or perhaps they can see that the other junior doctors have been bullied. So they don't know how to report, and there's no effective mechanism. So it create a culture. It create a culture, and this culture remains forever. Remains forever. And we can see now for the past 25 years, 27 years, we rarely heard that kind of action, suicidal action. Because of psychosocial hazard at work. Most of the time, the worst case scenario, the junior doctor will drop from the training. But now we see more cases like this. And to us, even though this is only reported cases, we do not know what happened to the unreported cases. I know this issues bigger than what has been illustrated from the news. But this is something that something that we need to change lah. But to change the culture, it is very difficult. Even though some intervention that we do, it takes about the earliest 5 to 15 years, but sometimes it takes one generation to change the whole culture. So it takes time. Perhaps whatever you learn today, it may sparks you become the agent of change that may change the culture in future. Who knows? So from that point of view, so this is another few slides talking about how to intervene this kind of scenario, how to intervene. So using this paper, in year 2025, we also have this psychosocial hierarchy of controls. Previously, maybe you understand or you familiar about hierarchy of control measures at work. Start with the elimination, start with the substitution, engineering control, administrative, and also PPE. But we can have similar principle that can be applied to the psychosocial hierarchy of control. So the level 1, the highest most important level 5, eliminate working conditions, substitute safer, healthier work processes and practices, redesign the work environment, administrative control, and encourage personal change. So let us look one by one. Let's say level 5. Level 5, eliminate working conditions that threaten. We cannot, we need to eliminate working conditions that threaten safety, health, and well-being. So we need to consider this. So in Malaysia, we have OSHA. OSHA, that is Occupational Safety and Health Act. That the objective of this act to protect the workers' safety, health, and well-being, and also the safety and health of the other person at work. So they protect the workers for the safety, health, and well-being at workplace, and also protect the safety and health of the other person at work. So how to remove this? It is about updated policy. So far, I didn't see such so far in my I always malingering around in other organization, but I never see starting about bullying. We are anti-bullying. We have anti-bullying policy. No, most of the time, yes, we have this. We committed that this workplace have no sexual harassment. So they talk about sexual harassment. Or free from chemical that can cause disease. So I already come across such thing. Even in banks, so they always talk about verbal abuse by clients, bank. So they say we apa macam ayat dia, bercakap baiklah dengan kami. So dia pakai kat ni, bercakap baik dengan kami. So dia portray the policy to the clients, to the client. Perhaps whenever they have such policy, they already experience some abuse from client to their workers. But so far, I never come across a policy stating that we are committed to prevent bully at our hospital. No. Or the houseman or the junior doctor, be nice to me. No bully, no bully. So I'm not I'm not entitled to be a victim of the bully. So far, none. So this is the first thing, the updated policy. This is the first thing that each hospital need to be considered lah. So most of the time, hospital policy talking about, we will deliver good healthcare services in 30 minutes, for example, in 30 minutes, blah, 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 blah. But never mention about how they protect their junior doctors against bullying activity at their workplace. So another way is that whenever policy exists, so perhaps we need to consider this zero tolerance. So this policy can be disseminated through appointment letter. So whenever you do this, senaraikan semua, this is the bully. So whenever you do this, the list of activities or the list of behavior, the list of scenario. So whenever you do this one of this, or the last one is, because we cannot write everything, so or any term that committee consider as bullying, so you are susceptible to be fired from the workplace, contoh. Or you are going to be downgraded from grade higher to grade lower, for example. However, the problem is we have this difficulty to determine what is bully, what is not bully. So we have this difficulty. But that one can be done because we need to have this kind of consensus agreement. We need to have this a kind of a committee that decide. Okay, so we need to invite also the junior doctor, the medical student, for example, the senior, the MO. So today is the day that we want to decide what is bullying, what is not bullying, so that everybody clear about it. Everybody have similar term. Everybody have similar definition in their mind, so that whenever you have explained this, you know that you already categorize this is bullying. Or whenever you have experienced this scenario, this is not bullying. This is incivility, purely incivility. So that kind of common definition is very challenging lah. It's very challenging lah. Because the words, but we can do this. We can do this. We can do this. So whenever you have that common condition, the common definition, then you can do the zero tolerance policy though. You can do the zero tolerance policy. And that is why I mentioned about this. Make sure whenever to have the common definition, you need to have this consultative and equitable decision. Meaning everybody in the system understand this is bullying. So whenever we have this common term, so we can apply to organization, to respective organization. But it does not mean that one shoes fits all. So we need to make sure the policy is really for the hospital setting. This is policy for the law, contoh lawyer, for lawyer, new lawyer. This policy for desk job, contoh. Okay. So that whenever we have this clear definition, junior doctors, even junior doctors can correct the wrongness of the system. So those even newbies can correct the system. And able to identify negative behavior. So this is something that need to have collaborative work or teamwork in that work environment, so that they're able to identify. Nobody keep silent. Everybody can identify and do action about it. And focus problem rather than who's right or wrong. And this is something like objectively. So most of the time, houseman will, there's a time houseman come forward and a lot complain about his or her experience. And whoever received the complaint said, no, you are wrong. Your registrar is right. So your behavior is wrong. So when that thing happens, so no houseman will come forward to say, to ventilate their issues or to log complaint. And whenever we identify the negative behavior, so next level 4, we can substitute to safer and healthier work processes and practices. So this is something that we need to consider, especially the regular team meetings. So each specialist, so they have their own grand walk round. So each specialist have supervised a certain houseman, and this medical officer supervise a certain houseman. So in a small group, and they know each other, they know each other's weaknesses and strengths. So they know how to say what to which kind of individual, so that they never come across the boundaries for certain individual. For example, orang yang anak manja masuk kat tu very harsh environment, so you tak boleh cakap begini contohnya, so you need to use soft word like parents, okay, son, or Dr. Fatin, you should do like this, A, B, C, D, rather than other extra comments at the end of the instructions. So for example, we can observe our parents. Our parents, if you can observe this, they treat their children differently. They treat the first child different compared to last child. Middle child also different. It doesn't mean that they love you differently. No. It just to show to us that that is the early lesson in the family, that we may receive different treatment from our parents. And that different treatment is considered fair, adil jika kena pada tempatnya. Ni memang ada isu agama di situ lah. Adil kalau kena pada tempatnya kan. Adil kena pada tempatnya. So it doesn't matter you receive differently. To first child mungkin your mom cara lain dia bercakap to last child cara lain bercakap. You jangan jealous kan. In between siblings pun you have this kind of differences in terms of receiving instruction from your mom. How the words delivered to you. So I am sure you already experienced this in your life, especially those yang have many siblings lah. Those yang only child in the family, that is another story lah. So perhaps you need to understand this. So then you understand why this person treats you differently at work. In a good way lah, in a good way, not the bullying issues lah. Okay. Next is level 3. We design the work environment for safety, health and well-being. Some people say like this. Perhaps indoor air quality in our work environment trigger the aggression behavior. For example, carbon dioxide level. Just because indoor air quality in our hospital it is not good, it may trigger the aggression behavior. So there's a paper support such a hypothesis, but still need more evidence to initiate need more evidence to confirm the statement. But this is something that need to be considered. In a hospital in Malaysia, they regularly measure about the carbon dioxide and they try to associate with the aggression event at work. So they need to validate the results, whether this is solely due to the indoor air quality or perhaps because of the person having the trait, aggressive trait, or perhaps the other modifying factors. So this is still need a validation process of analysis lah. But that is something that we need to consider lah. Or perhaps the environment of the work setting is so stuffy or it's so crowded and indirectly the condition degrade you as, am I a doctor or am I the construction workers? Am I the doctor or am I the maid in the ward? For something like that. So because of the work condition itself, some workplaces is very supportive, supportive work culture. So they have this team building activity. So whenever we have team building activity, the senior, the specialist, so they neutralize their roles while doing the game with the junior doctor, and during that time, so we know who is what is the inner side of the specialist. That specialist memang macam tu cakap dia, time game pun suara dia kuat macam tu kan. So during the inner we know the inner side of the specialist. We know the perspective of the specialist, then we feel safe. Perhaps like that lah. So foster supportive work culture, including team building activities. So this is something that perhaps can amend the condition of the bullying nature in the hospital. And the appointment of key personnel is very important. The key personnel who understand the impact of person and work environment interaction. Okay. So last one is administrative controls. Level 2, So this is about job description. So the specialist or registrar knows how much this junior doctor knows. So what is their expectation? And perhaps able to this houseman have luxury to report any violent incident and subject to investigation. So with secrecy and feedback. And also there's a protocol with the anti-bullying protocol, and perhaps whenever the registrar feels that they use harsh word, perhaps they need to come back to the houseman. I am so sorry that I used that word previously. It does not meant for you, for example. So that one we call as debriefing, debriefing. So this is it is not meant for you. Actually, this is meant for me or for the other person, because he cannot segmentalize the event prior to that event. So he cannot segmentalize, and the spillover effect of the emotion from the previous, then it's transferred to the junior doctor. And perhaps the victim have access to the crisis psychologist, so that this is the safe space for them to ventilate whatever, and to ensure that the psychologist does not share their story to the other workers and to the other doctors or specialists. So perhaps without mentioning them, so they can handle that cases. And last one, level 1, encourage personal change. So junior doctor need to change juga, and the senior doctor need to change also. Including resilience training, how to make a junior doctor become resilient, how to ensure that how to teach the senior doctors to make the houseman resilient, with using proper words, using different way of education method, the different words, for example. And perhaps you need to understand, you need to know what is the unknown. So go for the personal and professional advancements. So this is organization level if they have that kind of training. So for the individual, so you need to recognize between performance management and bullying. Good self practices. Whenever you have time to sleep. Whenever you have time to eat. So be resilient. Be resilient in the story. Be resilient and reframe again. So whatever the event that you expose during life, you reframe the event. It become a challenge to you, or it become benign to you, so that it does not feel stress. Don't ever treat the experience that you feel, even though it's unpleasant experience, treat it as challenge rather than threat. Okay, I think that's all for me today. So bullying is observable, explainable, because there's a model that talk about the phenomena, preventable, and yeah, we need to eliminate the source of bullying to guarantee bukan setakat patient care, but the junior doctor well-being and the positive image of the institutional care. Okay, for now, thank you.
Okay, thank you so much, Professor Dr. Rosna, for the insightful presentation. Actually, this topic of workplace bullying is indeed very interesting and highly relevant, because it is something that recently frequently occurs, not only in the medical field, but also in another work environments. And disrespect and rudeness behaviors are becoming increasingly common and can significantly affect the employee's psychological well-being. And like Professor Rosna mentioned before, that from the bullying, it can affect the patient safety and then increase the turnover rates, and also it could become a silent kills culture if it is not properly addressed. Well, that's the presentation from Professor Rosna, and now we will move to the Q&A session for the students. If you have any questions or would like to share your thoughts, please feel free to raise your hand, or maybe you can write the question on the chat box. And do not hesitate to ask the question in Bahasa. I'm pretty sure that Professor Rosna will understand.
No problem.
Yeah.
Apa-apa bahasa pun boleh.
Okay.
Indonesia boleh saya faham sikit-sikit. Malaysia pun boleh, tak ada masalah.
Yeah. Okay. I think there's a question. Okay, from the one who raised her hand. Okay, first for Karnis VS Daily. Would you mind to switch on the camera, please? Karnis?
Okay.
Okay.
Okay, is my voice audible, Miss?
Yes, it's clear.
Okay, so good morning, Buchita, and Dr.
Morning.
Rose.
Yeah, good morning.
Okay, my name is Karnias, but first of all, thank you so much for the insightful presentation that you gave for us today. I want to ask actually, it can be denied that bullying like this may also occur in other workplaces, such as factories and other places. However, in terms of occupational safety and health, like you said earlier, bullying is considered as a psychosocial hazard, which we as OSH students must be able to mitigate those risks or must be able to reduce the bullying. However, based on the cases presented, the level of bullying is very high, and it happens in big country like Australia or America, if I'm not wrong, in your presentation before. And I would like to ask how the hazard identification method in OSH can be applied to detect workplace bullying that isn't immediately visible, because in elimination slide that you said before, that we must identify the negative behavior, and in conclusion that you gave, that bullying is observable, but how we identification the bullying, is it we just wait the victim to report, or the other workers report the bullying, or observe the all the workers do? Because as we know that maybe sometimes the bullying cases is not can be seen, it can be just like private between two or three peoples like that. So I want to ask about that. Thank you, Miss. Thank you, Dr. Rose.
Okay, thank you. Yeah, I understand that some bullying may occur privately, only between the perpetrator and the victim. But majorly, we can observe it happen in a group, not just between perpetrator and the victim, but also the other healthcare providers can observe it. Okay, let me ask one first. The first one, between the perpetrator, only perpetrator and victims. So first, the victim able to identify he is being bullied. So to identify that organization, whenever these doctors enter to that organization, the organization can able to display. Okay, this long list. So whatever they say, presence of these keywords or presence of this term or statement or phrases, so this is bullying. So that is why the identification can be from the list. So whenever they have such lists, or then they can compare with their experience and the list. So it exists like that, or similar words also. Okay, they can lodge the complaint to the managerial level. That is one thing. But the problem is right now, each organization does not have such lists. We don't have such lists. I do not know why. That is because from my experience, perhaps we normalize. We saying, no, that is not bullying. That is only once a while incivility, but that is not bullying. So my intention is that to make the junior doctor become a better person, become a better doctor. He or she is going to be my colleague in future, my same specialty. So this is a kind of a kick-off point, so that the person know that he or she needs to work harder and read more and have a skill more in very shortened of a period of time, so that he or she can perform better. So he or she cannot does not call me in the middle of the night just to ask what to do with this patient that having apa tu plateau ECG. Sometimes this seniority, these senior specialists have their own point of view. So they say, no. To me, my words, yeah, is a bit harsh because I am orang Melaka, what? So I know this is, to me, in Melaka, okay. okay. But for orang Perlis, it is not okay. Sebab orang Perlis kata dia selalu guna perkataan lembut-lembut. Orang Melaka, kata, cakap okay ni. So salah dia lah sebab dia lahir orang Perlis. So dia cakap begitu Jadi kita tak pernah, we don't have such a long list to define. This is a list of bullying. Tak ada. Sampai sekarang pun tak lagi Tetapi let's say, kalau ada that list, it's very easy for the victim. So he or she knows that he had been bullied by that person, by perpetrator, because of presence of this word. This is very clear-cut objective. Or perhaps this individual person can lodge a complaint. But the problem is we don't have this effective feedback mechanism. So whenever this houseman complain, so lodge a complaint. So yes, we have proper complaint box. And who is handle the complaint box? Most of the time, handling the complaint box is only the clerk, the lower level of clerk. And then whenever they read the complaint, they start sharing the content of the complaint to the other workers. They don't have such ethic. So we fail to do that. If patient complains, it's okay to share, but this is very sensitive issues. So perhaps we need to have another secrecy system that complaint goes straight to the head of department, for example. Head of department, so that this head of department secretively can form a committee, so that this committee can investigate and verify whether there's bullying exists or not. And this committee, he or she cannot select the member of the committee from his or her circle of friends. So make sure the committee member is independent. Is independent from the department. Is independent from the jabat, from the scenario, from the specialist. Independent from the specialist. So that whatever they investigate, that is true objective findings, rather than I feel I know this guy, I know this specialist. He or she doesn't mean that to harm the junior doctors. So this one can cause bias to the investigation. So most of the time we have this protocol, but the problem is the head of department feel we don't need a committee member to investigate this. This houseman, this junior doctor already too manja, and that's why it create problems and it triggers the specialist to behave like that. So we have the protocol, but we fail to execute it efficiently. That's the problem. But in Malaysia setting, but that one is not bullying, but that one is sexual harassment. Sexual harassment, the junior doctors able to report, initially report to the hospital level, but since there's no action, but this lady is somebody, he's a daughter of a rich family who have link with the politician, something like that. He complained to the different channel, and her complaint was listened to, and it create a big hoo-ha in medical fraternity. So then the case is become national level news, and a legal action was taken to the perpetrator, and that case takes a few months to settle. Meaning whoever, because of inefficient of the feedback mechanism, inefficient of complaint mechanism, So that person need to take the drastic action. That's why it's very sad because it's happened at the organization level, but we know that each organization have their own culture. It depends on who is the head of department. It depends on the head of department career ladder. So sometimes I protect you, you protect me. So that culture still exists. So we are lacking in such a mechanism, then we fail repeatedly lah. So for the second scenario, let's say in the group. So in the group, so everybody, yes, can observe such thing, even nurses bagai. But most of the time, the senior staff already normalize such event as normal. It is not bullying. That is because they know already who is the specialist, who is the medical officer. They know, this specialist and MO is very efficient in their work. Yeah, he just playing around with you, joking with you with these words. And believe me, in 3 months' time, he or she will be nice to you, and he teach you something. Teach you something valuable. But be patient right now. So you please don't consider it as bullying, but just to jentik you, to push you so that you do better. You do better. Don't be such a stupid junior doctor in this hospital, for example. Because they already normalized and they no longer consider this bullying. But however, if we have again such list, such list exists, list of bullying exists, list of what kind of symptoms, what kind of word, what kind of phrases exist. So that stuff, I understand, hey, this one is, you use word that we can label it as bully, so this is cannot, so we can submit the report to the upper management level lah. The problem is we don't have such a list. Because very difficult. It depends on the culture. It depends on the culture. It depends on how you brought up, by harsh family or by broken family. So to you, this is nothing. This is nothing because the words doesn't affect you physically, but of course it kind of torture the emotions. But some people, they already normalize this. This is not bullying. That's the problem lah. Since that problem cannot settle, so we don't, even though we identify, we cannot do the action. And another one is identification of bullying sometimes is very subjective to the recipient and to the victim, because according to her or his vocabulary, this is words. They are words that they are not familiar with. And whenever they feel not familiar, they label it as aggressive words. Aggressive word. Even though the word is just not aggressive word, but to them this is aggressive word. But it doesn't matter. If there is effective mechanism, you can always lodge the complaint to say that you write properly the words that you receive. Then the committee member will investigate and to validate, yeah, this is bully, this is not bully. And you are able to accept the results, provided that the committee is a objective committee, does not bias to the perpetrator. Is that answer your question?
Okay, Kernis, is there any feedback?
No, Wuchita already answered my questions. Thank you so much,
Kernis.
Dr. Rose.
Yeah, thank you, Kernis.
Yeah, I extremely agree with Professor Rosnah that sometimes bullying is normalized. Being we share our feelings, then people will say that we are too sensitive or maybe overly emotional, or in Indonesia we usually call it as baper gitu. So yeah, baper, bawa perasaan. So maybe it's hard for those who get bullying to tell their true feeling, yeah, because people will judge and tell us that we are too sensitive or overly emotional.
Yeah.
Yeah. Okay. We will jump to the next question in the chat box. I think, okay, we have Winda Kasih. Winda Kasih write that, good morning, Dr. Rose. The material you presented is very interesting and provides new learning. Let me introduce myself. I'm Winda Kasih from Diponegoro University. I'm very interested in the discussion about bullying in the workplace in hospitals. I would like to know your opinion on how should a hospital evaluate the effectiveness of its anti-bullying policies as part of its annual health and safety audit. Thank you.
Semula.
Oh, sorry. I
Again.
will. Okay. Winda asks, I would like to know your opinion on how should a hospital evaluate the effectiveness of its anti-bullying policies as part of its annual health and safety audit.
How to evaluate, How to evaluate
How to evaluate the policies of anti-bullying in hospital.
evaluate the effectiveness of policy of anti-bullying.
Yes.
How to evaluate, most of the time, whenever they fail of policy, so meaning, first, we need to have policy first, then we do the arrangement. Meaning the arrangement is there a protocol, activity. If we don't have, if that organization, if that hospital does not have a program or activity or arrangement that reflects their policy, it means their policy failed. As simple as such. For example, let's say a hospital provide a policy. So we are committed that we have a culture zero bullying at our workplace. Whenever we saw the words of committed, meaning and they want to create a culture zero bullying policy, a zero bullying scenario at workplace, meaning they already have certain arrangement. Because from the policy, there's arrangement. So from that arrangement, for example, arrangement meaning any activities related to portray that their commitment, their policy too. For example, whenever they say zero policy at work, so they have this kind of arrangement. Arrangement like this, okay. First, you need perhaps to find a guidelines on how to handle a complaint of bullying. So guideline, then you investigate, step forward. From the guideline, you see whether this guideline follow or not. I am sure there's a case somewhere that you can follow, that you can observe as a case study to ensure that this program is effectively executed. So let's say they have this guideline. So there's, okay, where is your form, complaint form, in regards to the bullying? Where is the complaint form? Then you need to check the complaint form, the completeness of the form. What is the statement? Who is the bullying? How they perceive? What is the effects? For example. Next, you need to see the evidence. There is the form, standard form, empty form. Then you need, is there any case for the past 10 years, for the past 5 years using this form? Okay, you see this form. So there you need to see what is the action. Whenever you receive this form, what is the action? So perhaps there is a minute meeting, or an email regarding to appointment a committee member. Appointment committee member to validate the complaint whether this is bullying or not. So you check the email, you check the content of email and who is the member that have been pointed to investigate that scenario. So you ask, okay, this member, is it have conflict of interest with the head of department? Have conflict of interest with the specialist in questions? Have conflict of interest with the victim, for example? So we need to validate the objectiveness of this committee member. Next, you see what is the investigation report. So what is the investigation report? What is the method that they use to investigate the issues? Is they use a valid method? Is this method biased or not? So this is something that auditor can give input. So yes, it's very good. You have these very objective members of committee, but I can see that the report is biased because you don't have specific method on how to interview the perpetrator and also the victim. So because you use close-ended question, contoh yes or no, or perhaps your protocol sounds like interrogation rather than knowing the truth. So based on the okay, what is the protocol? I want to see the protocol. Or perhaps where is the recording? Is there any recording, sound recording, voice recording, or video recording? So from there, you justify whether this is interrogation system or the interview for solving the problem. So from there, you will look at the conclusion, or whether this is conclusion is valid enough. It is towards the improvement. So it does not finding faults. It meant not to finding fault, but to correct the system. How the suggestion may correct the system rather than correct the victim or correct the wrongness of the person too. When we correct the system. So we need to improve the system so that a person cannot adopt the behavior, cannot express such behavior, cannot execute such behavior to give instruction to the junior doctor, to have conversation to the junior doctor. So that's how you can evaluate whether the policy is effective or not based on the commitment, based on the arrangement they already did. That's one thing. So next, if you want to see, if you want to evaluate, next, is there any program that may enhance the relationship between the specialist and between the junior doctor, between the MO and junior doctor, to ensure that, yes, he or she have power while doing clinical decision, but not influencing the career investment for the junior doctor. So is there any program, let's say team building activity that may such relationship can be enhanced so that everybody understand their own strength and weakness, so that everybody knows, oh, this especially like this, mulut macam puaka tapi hati dia baik, contohlah kan. So ada orang macam tu kan. Ataupun okay, specialist ni memang macam ni tetapi dia tak, it does not meant to hurt me, but he is like that or she like that. So that one. But it doesn't mean that it is a kind of approval for the specialist to continue with their bad behavior. And this specialist may have need to undergo anger management training, for example. Okay, is there any evidence that this specialist already went through all such courses to manage their anger? Or they have a certain skill that have been given to the specialist or the medical officer so that they practice certain words to say the words, correct words to the junior doctor. So we need to see the training. What is the content of the training? Whether this content of training, or at the end of the day, we know that this training can change the ways of this specialist or MO whenever they communicate to the junior doctor. So that's how we can evaluate the policy. So you just not not solely solve the wording in the policy, but you look at the what kind of commitment that have been done and what have been done, whether this is effective or not, there is a bias or not, whether this is valid method or not. So you can decide as such.
Okay, thank you. Winda, is there any feedback or following questions? Okay. Winda said, thank you for your answer, Professor Ross. Okay. As the time showed 10:34 AM in Indonesia right now, and it's already 2 hours for this lecture, so we have to we are already arrived in the end of session, and maybe before I deliver the summary of the session, is there any closing statement from Professor Rosna for our students?
Okay, dear students, may you have some knowledge in regarding bullying in future workplaces. So being a doctor is not glamorous job, but being a doctor is about how resilient you are in handling those difficult situations, including on how to handle patients during difficult time. So to have such, this is very important for you to prepare mentally what is your future looks like. And I cannot say like our system is so perfect, so there's no flaws about it, but it's up to you to respond. You have a choice. You have a choice to respond to whatever the exposure that you may face into in future. So yes, you may experience the bully, but we have a choice on how to respond. We cannot change the person, but we can change how we respond towards the person. Okay, thank you very much.
Thank you very much once again for Professor Dr. Rosna Ismail for the insightful and engaging lecture. Unfortunately, we have to end the session because of the time limitation, and we truly appreciate the Bachelor Program of Occupational Safety and Health, Faculty of Public Health, Universitas Diponegoro. We truly appreciate your time and your valuable expertise for us today. Well, to summarize the session or the lecture today, actually, it reminds us the importance of learning industrial psychology, because for a long time we may have placed a greater emphasis on the physical aspects, but mental health has not always received equal attention. So from today's discussion, we can see that workplace phenomena such as the bullying are not only the interpersonal issues but significant psychosocial hazards that need to uh, that must be recognized, assessed, and managed just as rigorously as the physical hazards. A truly effective occupational health and safety system is one that integrates the both physical and mental health to ensure a safe, healthy, and supportive work environment. Well, I would also like to thanks for all the students or the participants for your active participation throughout the session. We hope this session has been insightful and beneficial for everyone. And we also hope that we will have another opportunity to meet again with Professor Dr. Rosna, whether it is online or maybe offline in Malaysia or Indonesia.
Yeah,
Please
bisa.
tell us, okay, if you want to to visit Universitas Diponegoro.
Yeah, baik.
Okay. With that, we conclude today's session. Thank you and have a great day. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you so much, Professor.
Thank you, Prof. Rosna. Thank you so
Thank you
much.
very much.
There is Mrs. Ida and Mrs. Eka.
Yeah.
They are the lecturer of
Yeah,
this.
Prof. Hani. Prof.
Oh, yeah,
Hani.
Prof. Hanifa also.
Thank you very
I
much.
was listening too. I was
Yeah.
listening too.
Wow. Thank you.
How are you?
Fine, thank you.
Okay. Thank you.
Goodbye.
Thank you so
Thank
much.
you.
It was such a great lecture.
Okay. See you. Selamat Hari Raya.
See you.
Selamat Hari
Bye-bye.
Raya. Minal aidin wal faizin.
Yeah. Goodbye.
Goodbye. Thank you.